the cost of health care. An unexpected first. Obamacare premiums are actually on the decline for next year. The Trump administration saying that the cost of a silver tier is down 1.5%. It still comes after the cost of that plan surged 37% this year. Joining us right now is Lonnie Chen. He is Hoover Institution Fellow and former policy director for Mitt Romney. Lonnie, it's good to see you this morning.
Good morning, Maria.
So the Democrats are focusing on health care going into the midterms. What's your take on these premiums going down next year? Does this move the needle for the midterm elections for Dems?
I don't think it moves the needle for them. Look, the reality is the Trump administration has been making the argument from day one that they knew how to administer this program better than the Obama administration did. And I think the evidence we have going into next year suggests that they might be right on that. Now, part of this, Maria, is because the Trump administration has actively engaged in efforts to give states the funding they need to bring down some of these costs. That's what we're seeing in states like Alaska and Minnesota and Maine. And indeed, I think it's had some impact. Now, going forward, the big question is going to be what's going to happen to Obamacare in the long run. And the stability of the program, fundamentally, I think, is still a huge problem. So we'll have to see where this goes in the coming years. As far as the midterm elections are concerned, I'm simply not convinced that this is enough to fundamentally change people's opinions of Obamacare.
Lanny, I'm a resident of Florida, and this has been a very contentious race so far with Andrew Gillum. What's going to happen with this? I mean, he keeps talking about Medicare for all, and it seems that a big part of the population is actually for this in Florida. I personally think it could be a disaster, but, you know, at what point do we really find a solution here on the healthcare side? Because, you know, if you look, you know, a lot of the HMO setups and a lot of the various organizations, I know within Florida because we have such a big senior population. How does this actually resonate with voters, and how can the Republican messaging change to its benefit?
Medicare for All would be a disaster for seniors. It would fundamentally change the program in a way that I think would be very problematic for seniors. Florida is a great example of this. You've got so many seniors in Florida that depend on Medicare. It's a program that they trust and they need. If you expand Medicare and open it up to everybody, if you do what Bernie Sanders and the liberal Democrats want to do, what you're going to have is a program that's going to be tremendously strained to serve the seniors that it was created and designed to serve and help. And so the problem is you're talking about a $33 trillion program. That's what Bernie Sanders' single-payer program would cost. $33 trillion program. That is not going to improve quality, that's not going to make health care more efficient or effective, and is going to kill innovation in our health care system. So this is a disaster waiting to happen. You know, if the Democrats decide this is their meal ticket to success, I think they're sorely mistaken.
What about technology? Salesforce CEO Mark Benioff and the CEO of Twitter, Jack Dorsey, going head-to-head over a ballot measure in San Francisco. What's your take on this? It looks like to tax large companies to help fund the fight against the homeless crisis. Your reaction to that?
You know, Maria, Jack Dorsey has spoken out against this, and I think he's absolutely right. The liberal mayor of San Francisco is against this initiative in San Francisco to tax businesses to help the homeless. Look, the problem in San Francisco, and I live in the San Francisco Bay Area, I understand the issues of the area. The problem is not that higher taxes are needed. The problem is there's not enough housing stock because the regulations are out of control. So you got to address the predicate problem first. The answer is not, hey, let's drive business out of San Francisco, let's drive business away because we think somehow that's going to help us address the homeless crisis. There is a homeless crisis, don't get me wrong. But the problem is not going to be addressed by another tax hike. We've seen this in California before. It hasn't worked before. It's not going to work this time.
How do you address the problem of homelessness then in San Francisco?
Well, I think there's a couple things. First of all, we've got a tremendous amount of regulatory restriction, as I said, that's restricting the ability of developers or others to build housing that will help low-income folks.
That makes sense.
And in particular the homeless. So that's where you got to start.
Regulation and then an attractive tax situation, and maybe not be a sanctuary city.
How about that?
Maybe that might help too.
How about that?
Yeah, improve the economy would be the number one thing to do there. Don't you think?
100%. I mean,
just say that we're just going to tax people to pay for homelessness. How about restructuring the whole economy, roll back regulations, a better tax base, and really focus on jobs?
work programs. I mean, you have to train people how to work. You can't just allow people to lay on your streets. I mean, there are
in order
so
to
many
focus
jobs.
on jobs, you also have to focus on being a sanctuary city. You have to get out of that,
That's
don't
right.
you think?
100%. You
This
can't
has
do
been a
both.
problem for over 20 years in San Francisco, and they never did anything about it. And now it's completely out of control, and it's a city people don't want to visit.
Typical to have that as the answer. Let's tax them. Lonnie, thank you. Lonnie
Thanks.
Chen joining us there.